Joining us now is Dr. Randeep Guleria, Director AIIMS. Thank you so much, Dr. Guleria, for joining us. India's medical fraternity is so bravely fighting this battle against COVID, often at a great personal cost. When hospitals are overwhelmed and the system is overwhelmed, what does it mean to you as doctors to see the way humanity has responded to help each other during this pain and suffering?
The last 1.5 years has seen a lot of pain and suffering. It's been a time of sorrow also, and many of us in the community have lost someone near and dear to us. For the health care workers, it's been a tough time. We've been working day in and day out, trying to really help people and really realizing that medicine is both a science and an art. So the art of medicine in terms of empathy towards your patient, in terms of caring, becomes more and more important during a time like this. But what has also really been very heartening for healthcare workers is the resilience that Indian citizens have shown. They've all come together, no matter what be your background, whatever little bit one can do, they've all come together and really try to help as far as this pandemic is concerned. Whether it's supporting people in terms of providing food, whether it's medicines, whether it's oxygen, or whether it's doing simple things like getting masks available for people, or going to the extent of making PPEs, making ventilators. I think from industry to the common man, everyone came together, and I think this really showed the true strength of our country in terms of fighting the pandemic.
You've also, Dr. Guleria, recently said that we need to focus on the lessons that we may have learned in the past and the possible third wave. I keep insisting on that, but I just feel that if there is the possibility of this third wave, what, according to you, are the biggest lessons that we need to learn?
So I think there is a lot of learning that we've had over the last 1.5 years. Some of it is, of course, for the medical community in terms of treating patients and how best to provide care. But the biggest lesson that we've learned, I think, is between the first and the second wave. And that is what will really help us to prevent subsequent waves. What can we do right, which we didn't do right in the past? And I think 2 or 3 things. One, of course, is the importance of COVID-appropriate behavior. Because no matter what be the variants that emerge, no matter what be the new mutants that we see, if we are able to maintain physical distance, if we are able to wear our masks properly, and if we are able to wash our hands and prevent crowds from forming and therefore not have super spreading events, then we will not allow the virus to spread. This is a virus which is human-to-human transmission. One person gives it to the other. There's no other way that it can spread. If we understand the importance of this and really follow COVID-appropriate behavior, come forward and get vaccinated so that the more the people who are the more the number that get vaccinated, the less the chance of transmission, the less the chance of viral replication, and the less the chance of mutants developing, we will actually be able to come out of this pandemic. We will be able to have a very minimal or delayed third wave. And this is what we need to do.
One of the things I think following on again from Amitabh Bachchan is that in a third wave, say it happens whatever, November, December, January, God knows when, and God forbid it happens at all. But we want our children to go back to school. But we keep talking about vaccines only for 18 plus. Shouldn't we think about our children? I mean, they are our goalkeepers, they are our future. It's like going into a cricket match without a wicketkeeper, without a football match without a goalkeeper if we don't look after our children. So shouldn't we really look forward and start considering vaccination of people under 18 as well?
So I totally agree with you. I think physical schools is very, very important for children and for college-going students also. And there's been a lot of this which has been sort of not been there. And when we talk of schools and colleges, it's not only about education, it's about character building. It's about getting people to have socialized, to really become good individuals, good citizens of the country. And therefore, physical schools are important. Also, it really marginalizes those who don't have access to the internet or not tech savvy. And therefore, that marginalized population has not had any education for the last 1.5 years. Therefore, opening schools is very important. But the other important thing is to do it in a manner that we don't allow the infection to spread and are able to protect children. I think to do that, vaccination is the strategy. Along with that, we will have to develop other measures. The Pfizer vaccine already has been approved for children. The Zydus vaccine, the Zydus Cadila vaccine, which is made in India, which is a DNA vaccine, also has been tried in children, as has been shown to be safe. And the Bharat Biotech vaccine is also undergoing trials, and hopefully by September, the approval for that should also come. The other important thing that I'd like to mention is, because this issue has always come up, that the third wave is going to affect a lot of children. I don't think that is true for 2 or 3 reasons. The previous waves and the ongoing pandemic has not caused a severe infection as far as children are concerned. Secondly, data that we looked at, a serosurveillance that we did at a sentinel surveillance, showed that a large number of children, more than 50% of children who were tested both in urban and rural area, already had antibodies. So they had got the infection, which was mild, and they had already been protected. Research will evolve, and we will have new research coming up. But the important thing is to remember that the virus is also evolving. So we have to be careful when we look at both how the virus evolves and what the research comes up, and whether that research is up to date with the way the virus is behaving today. Because what research we have may be a few months old, but that may not be relevant today, as we've seen with the older variant and the Delta variant. The Delta variant was much more infectious and caused this huge spike that we saw in the second wave, unlike the first wave, which was with the original Wuhan strain. So there is a sort of a time lag which we have to be cognizant of,
that is
and
a
therefore
big worry.
vaccine is something that we need to push aggressively in children.